So there's a trending topic on the internet that I wanted to talk about, and it's mouth taping. So let's kind of go over the pros and cons. Are you old enough? Are you too old for it? Can you mouth tape your baby? Can you mouth tape your grandpa? Let's talk about it. Hi, everyone. This is Dr. Esther Pedersen, and I am a master of the Academy of General Dentistry. I'm a fellow of the Academy of Clear Aligners. And between you and me, my passion in dentistry is about growth and development, especially with children and adolescents. So that kind of goes hand in hand with this mouth taping stuff I wanted to talk to you about today. So let's start at the beginning. Is mouth taping a good thing? Yes, I am all for it. I've actually been telling my patients about it for over a decade now, so I'm so glad this is catching on as a trend. So let's kind of dive in a little bit deeper. At what age can you start mouth taping? So if you're a new mom or dad and you have an infant, a nursing infant, all the way up from 0 to age 2, can you mouth tape them? And I would say when they're an infant and you're watching them sleep, you're holding them, you just nurse, they just fell asleep in your arms, don't mouth tape them. All you have to do is gently push their lips closed, and they'll actually learn that habit as you manually close their lips for them. It encourages their nose to open up, their nasal passages to open up. What are the benefits of doing that from an age 0 to 2-year-old? The benefits are you're going to change how they grow and what their bone structure actually turns out to be. So instead of having a long face and a downward, outward growth with their lower jaw, they're actually going to get a little bit more of a square jaw, the little bit more ideal mouth shape. Their tongue is going to learn to go up to the roof of their mouth and cause that natural expansion that I look for from ages 2 to 6. So speaking of ages 2 to 6, let's actually go on to that. At ages 2 to 6, they're sleeping on their own. You're not going in to check on them nearly as much as you used to when they're an infant. So for ages 2 to 6, you can absolutely start mouth taping. Now, the first time you do it, it's a little bit scary for a 2-year-old or a 4-year-old, not so much for a 6-year-old, but you want to do it when they're awake. So for when you do your bedtime routine, if you do their baths, I want you to take a moment to make sure that you're cleaning out their nose. You're going to manually clean out your nose, and that's true for everybody who's going to mouth tape. You're going to make sure that your airway in your nose is nice and clear. So if you have a cold or your child has a cold during that time, that's not the time to mouth tape. Wait until their nose is cleansable. And sometimes you have to do that with those little squeezy bulbs. You've seen those little bulbs that you put in there and you suck out the snot. Do that. It's worth it. It's gross, I know, but it's worth it. So I know in some countries, like my mom, when we were babies, they didn't have access to those kind of nasal bulbs. So she would just put her mouth over the infant's nose and suck it out. So you suck and spit it out, and that's okay. That's manually cleaning out your child's nose. So do what you got to do to clean it out. They are too young to do things like nasal sprays. Nasal corticoids are not okay for those ages. So 6 and under, no nasal sprays. So after you get it manually cleaned out, get a medical grade tape, and you're going to put it vertically, like a little strip going from their upper lip down to their lower lip, just to close the front portion so that the sides remain open. And I want you to do this while they're awake. So while you're doing your bedtime prayers or you're reading your last storybook for the night before you put them to bed and they're awake and starting to calm down, you're going to mouth tape, allow them to breathe. Their nasal passage will open up and then they'll be able to breathe. Then when they go to sleep, you might find that when they wake up in the morning, the tape is off. That might happen for the first 2 weeks, but almost always they come around to the point after those first 2 weeks that they go, I can't sleep without this. This is really good. Now, remember with mouth taping, the goal is not to do it for the rest of their lives. The goal is to do it until you get that growth and development, until you get that habit established so that they can get rid of the mouth tape. And then into adulthood, they'll sleep with their mouth closed automatically. So that's ages 2 to 6. So let's talk about ages 7 to 12. Actually, let's expand that. Let's talk about ages 7 all the way to 20. So in 7 to 20, you're getting a lot of bone structure growth, teeth growth. You're losing all your baby teeth. By age 12, you're getting in all your adult teeth. This is probably the most important time in growth and development in order to focus on that mouth breathing and closed mouth breathing. So from ages 7 to 20, what you're going to find is when you sleep with your mouth open, you wake up with a sore throat, your mouth is dry. It actually makes you a little bit more susceptible to colds and viruses that come by when you're at school, so that your child will start to pick up every little cold that comes through. So if you're a parent that has a child like that, then make sure that you go in there, sneak into the room, listen to the mouth breathing, or set up a camera and just watch them one night and see if they're mouth breathing. Another thing you'll notice if your 7 to 20-year-old is mouth breathing is on the edges of their teeth, they'll start to get this chalky white line. And that's actually a dehydration spot. That's a spot in their enamel where it's a soft spot. So when they're breathing and that enamel dehydrates and dries out all the way throughout the night, that actually is a weak spot in their teeth. So that's a telltale sign that your child is a mouth breather. So in that case, still do the medical grade tape in that vertical pattern that we talked about. Do it while they're awake. When they're teenagers, 12 and up, they can almost always handle it. They don't tend to freak out. They can clean their own nose. You don't need a nasal bulb for that. Have them clean their own nose. From ages 7 to 12, they're still too young for any nasal sprays. Don't use any nasal sprays there. From ages 13 to 16, all the way up to 20, they are allowed to use nasal sprays sparingly. So things that I want you to use are Flonase, Nasonex. Any off-brand of a nasocorticosteroid is fine. So you're going to do 1 squirt in each nostril, have them inhale, but not to the point where that liquid goes down their throat. You don't want to be swallowing the steroid, right? So you're going to keep it mostly in the nasal passages. So you're just going to inhale like that very gently, just enough to get it up into their sinuses. Within 5 or 10 minutes, their nasal passages will actually clear up, mouth tape, and go to bed. Same thing. They might take a couple weeks to just get used to it. So I have a 21-year-old daughter, and she was like, is it true what I'm hearing? Is it true that if I mouth tape, my jawline is going to get snatched? Is it true that my double chin goes away? Is it true that my profile gets better? And yes, it is. If you're consistent with it, that is very true. So there's lots of dental benefits to it, where when you're not drying out your teeth and your gums, your teeth are healthier. You don't kill the good bacteria that wants to live in your gums and fight off that bacteria. So your gingivitis is less, your periodontitis is less, or you don't bleed when you brush and floss. All of that is very, very true. From the aesthetic side of it, or what all my teenage girls are asking me about the snatched jaw. Absolutely. When you mouth tape, your tongue goes up to the roof of your mouth. That expands the roof of your mouth. It's going to give you that full smile that everybody wants, and it's going to help you maintain that after orthodontics. The roof of your mouth is the floor of your nose. So remember, when that expands, you actually breathe better, and you're building your body to do that on its own instead of waiting down the road to either have surgeries or come up with appliances to do that for you. Yes, it will retrain your tongue. And when your tongue goes up, your double chin goes away because it's not hanging out down here. So your profile will look a whole lot better. And that snatched jaw automatically happens. You'll probably notice it in about 3 weeks. Some people take up to 3 months to notice that jawline change. But yes, it's very worth it from that perspective. You'll also notice that your quality of sleep is better. So your teenagers that get the dark circles under their eyes when they're studying for finals and all of that will go away. Their skin will be clearer. They're more rested. They're not waking up in the middle of the night to go to the bathroom. And that's actually a telltale sign as well that they're having some trouble with sleep disturbances or breathing through their mouth. If you're in your 30s, 40s, and 50s, you're my people. So that's my age group. So does mouth taping still work for you? If you don't care how your jaw looks, you've already landed the hot wife and you don't care if you have a double chin, there's still benefits of mouth taping. In all my years of studying in dentistry, well beyond dental school, and in order to get my master's program, when you mouth tape and close your mouth, you are promoting a moist oral environment. And I know a lot of people hate that word moist, so I won't say it too many more times, okay? But when you keep your mouth closed, that good bacteria that naturally lives in your gums goes up, your bad bacteria goes down. And by bad bacteria, I mean the stuff that causes gingivitis, gum disease, the stuff that causes periodontitis, bone loss in your mouth, and gum disease. That good bacteria is also the bacteria that lines your entire gut. So those people in my decade, 30s, 40s, and 50s, you're probably really concerned about your gut health. You're probably eating your Greek yogurts to not only get your protein, but to make sure your probiotics are in your system. You may be taking a probiotic on its own. So remember, the lining of your mouth is the same throughout your entire digestive system. So if you maintain this, it's going to help everywhere. So we want to preserve that good bacteria that gives us the probiotics all the way down your digestive tract. So 30s, 40s, and 50s, you have options for different mouth tapes. You can do the medical grade tape going vertically from top to bottom. You might notice, or your partner might notice, that you start to breathe out the side of your mouth. It's a little harder to retrain because your body's been used to doing it for so many decades, right? So it's a little bit harder to retrain. So it's going to involve your partner, or set up your video camera and tape yourself one night and see how you sleep with the mouth tape on. If you're breathing out the sides, there are so many different options on the market these days. Everything from cute little lip-shaped stickers that you can put on to something that covers completely. Please don't use Scotch tape. Please don't use duct tape. Invest into at least the medical grade tape that's going to hold your lips together. When you tape your mouth shut, some people have an issue with their nasal breathing too. And I'll get to that in just a second, of how to know if you're going to need a tape to open up your nasal passages. But 30s, 40s, and 50s, you're going to see a lot of benefits in gut health. You're going to see a reduced risk of cavities. You're going to see a reduced chance of grinding your teeth, clenching your teeth, and breaking your teeth. So it's a really good thing. Do it anyway, even if you're 30s and 40s and 50s. If you're in your 60s, 70s, and 80s, and you breathe with your mouth open, if you snore, if you have to sleep in a separate room because your partner says, I can't stand your snoring and it keeps me awake all night, if you wake up to go to the bathroom in the middle of the night, if you wake up and your covers are all over the place and it's not nice and smooth, you haven't been sleeping in a comatose state like you should, then mouth breathing, mouth taping may not be the best option at your stage of life. After you go through menopause, especially for women, and you lose that estrogen that keeps the tissues nice and tight, when that estrogen depletes and you go through menopause, and men, your testosterone depletes as well, then all the tissues become lax. And when that laxity happens, that soft tissue, just mouth taping, may not respond well. So you don't have the ability to pick up that soft tissue anymore on your own. So seeing your dental professional about actually getting a jaw advancement appliance. It's just a mouth guard. And I actually have my mom in it right now. It's a sleep apnea appliance. And in her version, it's a snore guard with some metal. It's an upper mouth guard and a lower mouth guard that are connected together. And it pulls her lower jaw forward. So it picks up that soft tissue that her body can't do on its own anymore. And it holds that soft tissue off of the back of her throat. And she doesn't snore. So we just took a trip to Montreal to get my master's to celebrate that graduation. And I actually shared a room with her for that week and a half. And it was so pleasant to sleep with her. It was so easy because she had finally stopped snoring. And she's been snoring my whole life. So I hadn't known her besides snoring. So I'm so glad that she got that oral appliance. And in part 2 of this airway talk that we're doing, I'll get back and speak more specifically about the different types of appliances and the pros and cons of those. If you're 80 plus, you're screwed. Too bad it's too late. Just keep mouth breathing. No, I'm just kidding. It's never too late. It's always worth it to try mouth taping. If it doesn't work for you, see your dental professional. And if your dentist has not asked you about your sleep habits and your airway, it's time to find a new dentist. You don't want somebody who's just drilling and filling the cavities. You want somebody who's thinking of your whole self. You want somebody who's looking at all of you to say, what is the cause of this cavity? What is the cause of this sleep disturbance? What is the cause of all of this? And get to the root rather than just drill and fill. Okay. So a few different types of mouth taping. We talked about medical grade tape that can go vertically, top to bottom. There are quite a few different things on the market that I've seen come across my Instagram, everything that covers your entire mouth, upper and lower lip. And some of them include a little nasal patch. So you probably remember, like years ago, Breathe Right nasal strips came out, and it's like a little wire built into a tape, and it sits over the bridge of your nose and it picks up your nostrils a little bit. It's amazing how just that little millimeter of lift, just a small degree of lift, makes such a big difference for your airway. This is the way to know whether you need the nasal strip or not. Okay. So I want you to do this little exercise while you're watching this video. I want you to exhale fully. I'm going to talk you through it. Exhale fully. And then exhale a little bit more. Then I want you to inhale really hard with your lips sealed and close nice and tight. Inhale through your nose as hard as you can and as fast as you can to fill your lungs. Okay. So I'm going to do it with you. Okay. Ready? Exhale. Exhale a little bit more. Close your lips and inhale. Now watch closely. Watch my nose there. I'm going to do it again. Exhale. Exhale a little bit more. Inhale. You see how my nostrils went in just a little bit? That's called nasal prolapse. If your nostrils cave in, or do this with your child too, if their nostrils cave in, then that might be a sign that nasal strips would be a good benefit for you while you're mouth taping as well. Some people, when you try to inhale, one nostril will close completely. That's nasal prolapse. Both nostrils might close completely. If genetically you have nostrils that aren't big enough to stick your finger in, they're more like slits, then nasal taping is going to be a good option for you. So do that little nasal stenosis check and see if that's going to work for you. As far as the different mouth tapes go, you have to find something that the adhesive doesn't react to your skin. I like the medical grade tape. There's a book called Close Your Mouth that I refer a lot of my parents to. I think it's a really good way to train your children on how to sleep really well. But again, with mouth taping, get the cute stuff. If you don't react to the glue on it, have fun with it. If you do start to react to the glue, remember you can change between different types of adhesives. There are actually a few hypoallergenic strips out on the market too for lips and nose. So do a little bit of research. You can do the trendy stuff. You can do the basic stuff for all different price ranges. But again, mouth taping, I'm all for it. It's a good thing. And if you have any questions, feel free to post them below and I'm happy to answer. So thanks for joining us on this podcast all about mouth taping. We will talk again next time about airway and we'll do a part 2. Bye, everybody.